Since the earliest days of America's struggles for independence and expansion, nurses have helped save the lives of our warriors, sometimes right on the field of battle. In the proud legacy of pioneers like Sarah Borginis and Florence Nightingale, the nurses of the Navy and VA have a long history of providing care to service members, veterans, and their families for over 100 years. Today, nowhere is that dedication to heal our wounded warriors and veterans more evident than in the nursing program at the Captain James A. Lovell Federal Healthcare Center in North Chicago, Illinois. Through an integration of the North Chicago VA Medical Center and the former Naval Health Clinic Great Lakes, the Navy and VA created a unique working environment at the FHCC, with uniformed military nurses working alongside civilian nurses in the 1st Joint Department of Defense and Department of Veterans Affairs medical facility. They are now one team dedicated to the well-being of a very diverse patient population and providing patient-centered care. And that diversity is present in every part of the FHCC. Here, nurses are service providers, leaders, and educators. One day, nurses may be treating a patient and training a Navy corpsman. The next, developing posters and materials that both educate and motivate. And the next day, making a presentation to fellow nurses and providers on new techniques and best practices. FHCC nurses also ensure professional nursing associations have a presence at the center to help foster camaraderie, offer career guidance, and organize charitable work at the facility and in the community. There is also always an emphasis on good communication through innovations like a nurse's website, which helps keep the staff informed and organized. This supportive environment leads to retention. Many civilian nurses have remained at the facility for their whole career, and many Navy nurses who worked in Great Lakes have returned to the center as civilian nurses after completing their military career. The end result is dedicated nurses, and dedicated nurses provide high-quality, safe care that places the patient at the center of all of its services. FHCC nurses and their colleagues care for a diverse patient population that includes active duty military, military families, veterans, and about 42,000 Navy recruits yearly. The FHCC is also the only healthcare center associated with the VA that combines veteran care alongside pediatric care. Nurses and providers care for veterans who are homeless, offering counseling for drug and alcohol abuse and psychological issues. The facilities at the FHCC are broad and unique. The center has an East and West campus, as well as 3 community-based outpatient clinics called CBOCs. All locations incorporate top-of-the-line equipment run by skilled nurses and healthcare providers. On the West Campus, the main building is the center of the facility and the primary location where nurses both treat patients and help train current and future Navy hospital corpsmen. Communication and organization in these areas are key, and nurses huddle twice daily to discuss individual cases and upcoming patient loads. Also on the West Campus is the Community Living Center, essentially a nursing home within the FHCC. This area encompasses the greenhouse homes, providing a unique assisted living home environment on campus, where nurses provide assistance as caregivers and companions. On the East Campus, Navy and civilian nurses work together in support of Navy recruits and new sailors at Naval Station Great Lakes. Beyond the East and West campuses, healthcare extends well into the surrounding communities at the 3 CBOCs, bringing the same top level of service to the community where the patients live.
How about lunchtime? What's your typical lunch meal?
Here, each CBOC is equipped with a telehealth system, which increases access to care by offering synchronous, real-time care and case management. Nurses play a critical role in identifying patients who would benefit from this service and assisting with their enrollment. Keeping an eye on the future, the FHCC also works closely with colleges and universities to train nurses in clinical practice, as well as strive for excellence in nursing practice through the FHCC Regional Simulation Center. At the FHCC, we have a dual role. That is, taking up the challenge established by Abraham Lincoln, to care for him who shall have borne the battle, and for his widow and his orphan, and to ensure the highest level of operational medical readiness for our sailors. That challenge could not be met without the teamwork and dedication of one team, Navy and VA nurses working together to provide an unparalleled level of patient-centered care every time, everywhere, by everyone. At the Captain James A. Lovell Federal Health Care Center, readying warriors and caring for heroes.